Ladies and gentlemen, you're listening to me, Dr. Ali Karamet, on a program on diabetes on ramadanradio.org. You can contact us in the studio on our number 477-614-60614 through call, text, or WhatsApp, and also listening to our program on Ramadan Radio London 87.9 FM. So thank you very much, firstly, for giving me an opportunity to come and talk to you today about diabetes. It's a very common condition and affects a lot of people in the Muslim community. What I will try and do is talk to you guys a little bit in general about diabetes and also answer some questions which are very commonly asked about diabetes. So the first thing, just to sort of set the scene a little bit, is to explain to you what diabetes is and sort of what the types of diabetes that we commonly see. So diabetes is a condition where our body does not sort of metabolize or work on glucose levels very well, and it doesn't work very well, and as a result, you tend to have higher levels of glucose, which can then cause problems in terms of complications at different levels, including, God forbid, for eyes, for kidneys, and for feet. There are two main kinds of diabetes which people should be aware of. There are other forms as well which are very rare, but there are two main forms of diabetes. And the two main forms of diabetes which we know about are type 1 diabetes and type 2 diabetes. So in my work, which I work as a consultant in diabetes in Birmingham, I specialize in type 1 diabetes, which is the diabetes that commonly affects younger people and is diagnosed at a much younger age. But we also have a very common problem of type 2 diabetes, which affects the Muslim population, and we see a large numbers, particularly in the South Asian population. And one of the questions which I'm very commonly asked is, why does diabetes affect so much in the South Asian population? And there are a few different reasons for it, and it's, I think, a combination of genetics plus lifestyle and the kind of jobs that we are involved in as well. So there are a number of areas as a result of which we see commonly diabetes affecting the South Asian population. But diabetes, a diagnosis of diabetes does not mean that you can't actually live a normal, healthy life. Diabetes actually means you can still completely live a normal, healthy life. And actually, by making a few adjustments in your lifestyle, and if you need medications, taking your medications regularly, you can actually live a very healthy and normal life. So that is a really important message which I want to say today, because a lot of times people look at a diagnosis of diabetes and it is something which they really feel scared about. And yes, you need to do some changes in terms of your lifestyle and in terms of how you look after yourself, but it still means that you can actually have a completely normal life and can actually do a lot of normal healthy activities. There are a lot of athletes, for example, who live with diabetes and actually have been able to live a completely normal life, and in terms actually been able to compete in competitive sport as well with the diagnosis of diabetes mellitus. So that's a little bit about what diabetes is, the different types of diabetes, and how it can what you can do at a personal level or at day-to-day basis to try and control things a little bit better. Now, talking to you about diabetes on Ramadan radio and talking to you about Ramadan will be really important. So one of the other things which I'm asked, particularly around this time of the year, the blessed month of Ramadan, can I actually fast safely if I have diabetes? I think that's a really important question, and there's been a lot of work done in this area by people like myself, alongside some of my colleagues internationally and in the UK as well. We've done a lot of work in this area about diabetes fasting and Ramadan, and whether you can fast safely in Ramadan. There are a number of risk factors which we would always advise people to be looked at. The first thing I would advise is that you actually talk to your healthcare professional your GP if you have any intention to fast, or if you are in the care of a diabetes specialist nurse or a diabetes consultant, then you should always inform them that it is your intention to fast during the month of Ramadan. And if you say that, then they can come up with an individualized care plan which would be relevant for you and can actually work safely for you throughout Ramadan. People who have type 2 diabetes, which was the type which I mentioned, the second one, and they are on tablets, for example, with good levels of control and no problems with any hospital admissions or their glucose levels dropping very low or very high, can actually fast safely with advice during Ramadan. So that's the first thing to say. You can be actually supported with in this with by your healthcare professionals. But for those who have diabetes, which is, for example, requiring treatment with injections, common injections are drugs such as insulin, for example, which is needed for some people with type 2 diabetes, and almost everybody with type 1 diabetes will need treatment with insulin. Then our first point of advice would be that you should think carefully whether you are going to fast, and if you have any risks such as your glucose levels dropping very low or very high, if you've had any hospital admissions, or overall your diabetes control is considered unstable or high, then we would advise you that you should not fast during Ramadan. And Alhamdulillah, in our religion, there is a lot of leniency with this regard. And actually, because of health reasons, if somebody is not able to fast during Ramadan, then the religion actually does certainly cater for that and does certainly take that into account. And we have had multiple discussions with a lot of religious scholars, and they are on board with some of our work which we've done as part of the International Diabetes and Ramadan Alliance, which includes people from the Middle East and some people from ourselves in the UK who have been part of that. So that is a little bit of information in terms of diabetes and Ramadan, to try and explain to people if they wanted to fast during Ramadan, whether they can fast, what sort of things would we look at as a healthcare professional if you came to us and expressed your wish that you wanted to fast during Ramadan, what would our advice be, and on what basis we would give that advice. And actually, with some simple tweaks of medications, a lot of people are able to fast safely. So this is an important message to say to you guys. Now, the other bit which I wanted to talk to you today was, which is obviously very topical, is about COVID-19 and diabetes. And again, one of the very common questions and something which has been asked by a lot of people of me is that does having diabetes mean I'm more likely to catch COVID-19? There is no suggestion that just having a diagnosis of diabetes means you're more likely to catch COVID-19. However, there is a slight risk with diabetes that your COVID-19 infection, if you were to get that, could be more severe than the other people. And there has been some work done with this regard, and that's kind of looked at people both with type 1 and type 2 diabetes. And this was done, a lot of work was done in the UK, which looked at this. And they did suggest that in both elements, with type 2, perhaps 2 times more likely, and in type 1, perhaps 3 times more likely, people were to suffer sort of not very good consequences if they had an infection with COVID-19 and had these types of diabetes. Now, what can you do to prevent that? I think, as I mentioned earlier, healthy lifestyle is a really, really important bit of management of diabetes, but also making sure you adhere to the guidance which is there, adhering to the mask wearing, adhering to social distancing, adhering to the general principles of what is being suggested by the governments all over the world, really, not just in the UK, but adhering to those guidance and making sure that you are minimizing your risk of going on to develop COVID-19 if you have diabetes. Talking about COVID-19 and diabetes at the same time, also want to emphasize the importance of getting yourself vaccinated. We've been extremely fortunate in the UK that our vaccination drive has worked extremely well. And certainly with people with diabetes have already or already should have at least had an offer of being vaccinated, as they were in the higher risk category. And a lot of my sort of people that I look after, for example, people living with diabetes, have actually already had their first dose at least of the vaccine, if not both doses of the vaccine. I think an important point to remind people here is that if you are fasting, you can still go and have the vaccine, as it is an intramuscular injection. You can still go and get that. And again, there has been a lot of work done in the UK, and a lot of our religious scholars have actually done some work as well, where they have clearly made this discussion and made this point very, very clear to people that you can actually have the vaccine and during the state of fasting. The important point in terms of COVID-19 and diabetes would be with regards to fasting, that if you actually do have any symptoms of COVID-19 or are actually ill with COVID-19, then I think a medical advice or sort of advice, scientific, would be that you should ideally not be fasting, because with COVID-19 there is a bit of a risk of dehydration, which can get a bit worse if you're fasting during Ramadan. So that's an important point or important message with regards to the diabetes and COVID-19, and also the vaccination side of things, which I wanted to want to reinforce. The vaccination side of things is again very, very important. When you are called, when you have the opportunity to be actually invited for the vaccination, that you do take that opportunity and you look at that as just a service to yourself, but also in general to humanity. And the important message here is that you actually are not just protecting yourself by getting vaccinated, but you're actually protecting the general population as well when you are getting the dose of the vaccine, and that you can have it while you are fasting as well. So that's a little bit about COVID-19 in the context of diabetes, what you can do to prevent it, what does it mean in the context of diabetes, and also what would be our sort of advice, or what would we be suggesting to you in terms of vaccination during fasting. So just to remind some of our listeners who may have just joined us, you are listening to a program on diabetes with me, Dr. M Ali Karamet, on Ramadan Radio 87.9 FM, online at ramadanradio.org, and also streaming on Facebook. You can call us, text us, or WhatsApp us with your feedback, questions, or comments on 077 614 606 14. Now, talking about diabetes, one of the elements which I wanted to emphasize to people and sort of discuss this a little bit more in detail is that why do we actually, when we say that it's important that you control the diabetes and actually it works, and your levels of glucose, for example, in your body are not running too high, why do we actually say that as healthcare professionals? What is the reason for asking you to control your diabetes better, and what is the relevance of that? Now, the diabetes relevance for controlling and making sure that you don't run into problems with complications. So we know that with diabetes, if diabetes is not well controlled, it can lead to complications. And the areas of the body where it can lead to complications include your eyes, in particular, also your kidneys and your feet. But none of these complications are that they are definitely going to happen because you have diabetes. You can actually control them if your diabetes control is good, and if you can actually maintain the levels at a good range where your levels are not running too high. If you're able to do that, then we've had people in our service, for example, with diabetes who've had diabetes for over 50 years and have actually had very little, if any, complications, or even if they've had any complications, there may be a couple of spots in the eyes, but they've remained like that for all this time. And actually nothing has got worse in terms of their diabetes control for all those years. And yes, there are innate differences between people, and some people are more prone to have complications than others, but you can actually make a lot of effort in terms of controlling your glucose levels, which will make a big difference in the long run in terms of your controlling of diabetes. Making simple adjustments to your diet, being healthy with your lifestyle, making sure you are physically active. These things you can do on a day-to-day basis, which actually would make a big difference. And an important point to remember is also that we commonly would just look at the foods and actually say, well, I don't take any sugar, that's just me preventing diabetes or doing that. But there's actually a lot more things as well which contain glucose sort of things and not just sugar. So I think it's important to look at other elements as well in your diet, and in particular trying to maintain a healthy lifestyle with physical activity, with walking as well, because we know that that will make sure that your glucose levels are then metabolized very well, and you don't suffer any of the complications of diabetes. We live in a strange world at the moment with the pandemic and the impact we're seeing, not just in the UK, but we're seeing worldwide now with devastating impact in India, for example, and situation also being not very good in Pakistan, for example. So I think we should just pray ourselves that we are in good health, and also make sure that if we have the opportunity, we get ourselves vaccinated and make sure we don't have this problem. Also making sure we use the day-to-day resources such as wearing our masks, maintaining adhering to social distancing, and look after ourselves. If you have any problems with diabetes which you want to sort of discuss with your primary care, with your GP, then please by all means make sure that you actually talk to your GPs. Our GPs or secondary care diabetes services, they are fully open, and we are there for your service. If there are any questions which people have, anything which people want to ask with regards to diabetes, then please do ask those questions, and please do make sure that you actually are asking these relevant things, and you're actually regularly awaiting the care which you're getting, both in the community or in some instances if you're being looked after in a hospital or in other secondary care settings, you're actually going to the team and getting your diabetes properly looked after. Now, one of the elements which I wanted to also briefly touch on is the treatments which we have available for diabetes. And treatment in diabetes is advanced, certainly even within the time frame that I've been working in the field of diabetes. We've had a lot of new medications come along, particularly tablets. There are some new injections come along as well. There's lots of new technology for different ways of monitoring the glucose levels in the body. There has been lots and lots of advancements which have come about. I think one of the areas which I wanted to briefly touch upon was the fact that there is a treatment for diabetes, which is insulin, which is in the form of injections. And I think it's important to remember that if somebody is recommending insulin to you for your diabetes treatment, there is a very good reason why diabetes treatment is being recommended with insulin. Either the control is very high, or you have type 1 diabetes, which means it will only respond to insulin. So this hesitancy that we have about insulin, it's important to remember that the reason why we would be recommending as healthcare professionals would be because either your body is not producing enough insulin, or what is there in your body is not enough to manage your glucose levels. So it's important to try and tackle this stigma of insulin, and actually making sure that if you need it, you actually are taking it at the right time and appropriately using it. So there has been a question from the audience, which is about whether there is actually a cure for diabetes, and can diabetes actually be completely got rid of? That's a really, really good question. I think when I started the program, I talked about type 1 and type 2 diabetes. And I think if I make it very clear right here that with type 1 diabetes, there is actually no cure or remission that exists at the moment. So that's an important point to make, that there is no remission or cure for type 1 diabetes. However, if you're talking about type 2 diabetes, then there is actually some aspects which would suggest that if you actually can control it with your diet and with your lifestyle, you can actually achieve what is regarded as a remission of diabetes. And there has been a lot of work done in the UK in that. So there's a big study which was done in Newcastle by a gentleman called Professor Roy Taylor, in which he showed that by restricting your calories and by restricting the amount of food, for example, for a period of weeks, you could actually achieve remission in diabetes, in some instances in people who had diabetes for up to even 10 years. And that was very impressive data. The challenge is actually maintaining that, sustaining that over a period of time. But actually, if you are able to achieve that remission in the beginning, then by adopting your lifestyle at a less sort of aggressive level, you can actually achieve and maintain and that long term as well. So that's an important point, that yes, with type 2 diabetes, you can actually achieve a remission if you work on the diet and the lifestyle elements of diabetes. You can actually make some changes which can be life lasting. With type 1, less so, but in some very, very rarer forms of type 1, which are leading to a lot of complications. In some instances, there are transplants, for example, which happen, but they are very, very rare and only in people who are having life-threatening problems with diabetes, such as kidney failure or severe elements of glucose levels dropping, where we do transplants. So it's not something which should be really regarded in type 1 as a cure per se. There's been a question with regards to the foods in diabetes, and a common question again of food which is sort of asked is, what about rice and what about roti? Yes, I think both of those elements, you're absolutely right, have got carbohydrates in it, and both of them will cause your glucose levels to go high. So you can actually make little changes. So for example, if you go for brown flour or brown rice, that will make a difference. I think both of those things make a difference. But what we are saying here is that we, by no means I'm sitting here and actually suggesting to you that we go for a complete carbohydrate restriction. Carbohydrates are essential for your diet, and they're an important, stable part of our diet. So you can't completely not have roti or not have rice at all. People are individual and people are different. And I think when somebody asks me whether it is rice or roti, it depends on you. So some people will probably find that when they actually have brown rice, their glucose level doesn't go very high at all. Others will actually find that it's actually the brown sort of roti, for example, or the brown flour, which actually works better for them. So the important thing would be to actually check your glucose levels, if you have got the facility to do a blood glucose test with a machine at home, with both elements of the food, and actually see which one of those works better for you and which one of them causes your glucose levels to go higher. And what I would say is that even if your glucose levels went higher with one of them, it does not necessarily mean you completely can't have that at all. Actually, using simple things. So, for example, if you know that you're having rice and your levels are actually likely to run a little bit higher, then doing a bit more of a physical activity in terms of walking, for example. In the UK, we've got lovely weather at the moment. It's quite nice weather to actually be able to do some walk. That can actually make your glucose levels come down really nicely. So this is not to say that you can't have something completely at all with diabetes. You can have things in moderation, and if you're able to then adjust for them with your lifestyle and with a bit of physical activity, and having a healthier option out of them, which one is available, would be my advice. And actually, if you want to check it, you can test both of those, and usually test your glucose levels probably an hour and a half after eating on a couple of occasions to see which one actually works better for you. And that's your way of testing whether it was the rice which actually worked better for you, whether it was the roti which was a better option for you at a personal level. So I think that would be the way I would advise you to test your diabetes and see which one of them works better. There are some people who would have diabetes who might be on only one tablet, for example, a day, who would not have been provided with a blood glucose meter. And I think I'm not saying that everybody with diabetes needs to be having sort of a blood glucose meter or testing. But I think if you are on a blood glucose medication, which is likely to cause your glucose levels to go low or drop, then ideally you should be having a blood glucose meter, and you should be testing your glucose levels with relevance to different times of the day, particularly with relevance to driving. For example, there are clear driving regulations if you are on such medications which can cause your glucose levels to go low. For example, insulins, or there's another class of drugs called sulfonylureas. If you're on one of them, then you should be testing your glucose levels, particularly with relevance to driving, and actually making sure that you are keeping yourself safe, and actually you're keeping the public safe as well when you are on the road. So those would be some of the advice and some of the comments I would say to the questions which the audience has so far asked with regards to diabetes management. I think the important message here, if I can reinforce that again, is that diabetes is a condition with which you can live a completely normal life, and actually you can make a simple sort of changes to your lifestyle, adopt a healthy lifestyle, which can go a long way towards preventing complications and ensuring that you actually live a long, healthy, and prosperous life. You can fast safely with Ramadan as well, with diabetes, as long as you're not having any problem with your glucose levels running very, very low or very, very high, or you're having any hospital admissions, and we discuss that with your healthcare professional. If you get the opportunity to get your vaccination, go and get yourself vaccinated. Make sure that you're getting that. One thing which I forgot to mention earlier, which I can touch on now, is something which people ask is, which vaccine should I go for? You go for the vaccine which is available. Vaccines are effective. Whichever vaccine is available, you go and go for that. Rather than going and choosing that, I'm going to wait and I'm going to do this. I think it's important when you get determined that you actually get yourself vaccinated for yourself and for the population. Making sure with the pandemic that you're actually adopting the social distancing, mask wearing, and avoiding big crowds and avoiding heavy gathering. Outside is always safer than inside. Outside, particularly with the fresh air, is much less likely to see the spread of COVID-19 particles. So making sure that we're actually using these aspects and keeping yourself safe, knowing a little bit about the differences between type 1 and type 2 diabetes, and actually also realizing that you can even do things with type 2 diabetes to go for a complete cure or go for a complete remission of diabetes if you look at your lifestyle, and you can make the adjustments to your lifestyle and make the changes which are necessary. So this was really quite a sort of a quick whistle stop tour from my side about diabetes and some of the elements which are particularly relevant in this day and age with regards to the pandemic, with regards to the alhamdulillah, the fasting, the holy month of Ramadan, and the aspect of cure of diabetes, and also a little bit about treatments of diabetes, particularly when we recommend things such as insulin, the injections, why we recommend it, and why it is important that if you're recommended a treatment, you actually go for it, and you actually utilize the resources which are available. You were listening to me, Dr. Muhammad Ali Karamet, in on RamadanRadio.org. It's been an absolute pleasure to actually be here with you, and it's been nice to actually be able to answer some of your queries as well with regards to diabetes management and some of the elements which we wanted to cover. Jazakallah khair, Ramadan Kareem to all the audience, and I hope you can all have a safe and healthy Ramadan for the rest of the time, and may Allah give us the tawfiq to actually pray for the remaining month of Ramadan which we have there, and actually forgive our sins and give us the opportunity to actually live a healthy, prosperous life. And may Allah also keep us safe from the impacts of the pandemic. Jazakallah khair. Thank you for listening to me, Muhammad Ali Karamat, on Ramadan Radio 87.9 FM. Till next time, Assalamu alaikum wa rahmatullahi wa barakatuh.